All of us have someone that we love who has a mental health issue. In our country, the suicide rates have gone up dramatically over the last 10 years. There will still be conversations that we all are involved in every single day, or at schools where someone is called crazy or something pejorative. In my estimation, mental health is one of the leading causes of death, and it's so treatable.
It's one of our responsibilities at Anne Arundel Medical Center, and now, of course, Luminous Health, to measure what the needs are in the community, and to the extent that there are gaps in our clinical services and programs, to fill those gaps. So we certainly know from our own experience at Anne Arundel Medical Center that we were transferring more than 1,000 patients a year to other inpatient psychiatric centers across the state of Maryland. And that need is very real right here locally in our community. So we applied for a certificate of need through the Maryland Healthcare Commission in March of 2016. And that went through a couple years of a process and answering additional questions and meeting with the state regulators. And they ultimately approved us to move forward with the construction of the new inpatient facility.
The benefits that the community will see from this model of care are that their loved ones will be able to stay in the county and not have to go to a different county, 30 miles away to get treatment.
I got involved really at the early onset of the project when we started talking about the concept of behavioral health. We ended up getting the CHINA, which is a Community Health Needs Assessment, and then started working through with different departments of what does that mean and how do we support the need for the community. CRJ Design has been involved in the project from the onset. Chuck Goodman is the architect of record, and Sandy Goodman is the interior designer. They did take a very personal, vested interest in the project. Chuck and Sandy have both been great on looking at things like color, aesthetic, function, flow, to make sure that it gives it the best possible outcome for patients, but also provides a safe and secure environment for the staff working in it.
The environment of McNew was very important to get correct. We wanted it to be beautiful and peaceful and positive. And we wanted to have people have that sense of security, safety, and yet light. Light comes in from different sections of the walls. We wanted people to feel like they are worthy of really top-notch treatment and care.
We are very fortunate to have so much community support for the work that we do at Anne Arundel Medical Center. People like Kent McNew, who stepped up and recognized this as a priority and really helped to fund and initiate the campaign to be able to open this service.
Kent has been a volunteer, a donor, a leader in this health system and in this community for 30 plus years. When you look at how the community has been involved in all of this, it's very exciting because frankly 10 years ago it would have been very difficult to raise money of any kind for mental health care. It was not something people focused on. I hope they look at this building and this new medical center with great pride at what this community has done to ensure that this kind of care is available not only for patients suffering from diseases of mental illness, but also for their family members.
I'm actually very, very proud of Anne Arundel Medical Center, the investment that we're making here, the commitment to the community, and the whole team that has worked on the design, the development, the philanthropic arm of this, to be able to stand up the operations of this facility and enable people to be able to get the care they need close to home.